Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Once weekly semaglutide in persons with obesity and knee osteoarthritis. Background. Weight reduction has been shown to alleviate symptoms of osteoarthritis of the knee, including pain. The effect of glucagon-like peptide 1 receptor agonists on outcomes in knee osteoarthritis among persons with obesity has not been well studied. We conducted a 68-week, double-blind, randomized, placebo-controlled trial at 61 sites in 11 countries. Participants with obesity, a body mass index, BMI, the weight in kilograms divided by the square of the height in meters, of greater than or equal to 30, and a clinical and radiologic diagnosis of moderate knee osteoarthritis with at least moderate pain were randomly assigned, in a 2-to-1 ratio, to receive once-weekly subcutaneous semaglutide, 2.4 mg, or placebo, in addition to counseling on physical activity and a reduced-calorie diet. Results. A total of 407 participants were enrolled. The mean age was 56 years, the mean BMI 40.3, and the mean WOMAC pain score 70.9. A total of 81.6% of the participants were women. The mean change in body weight from baseline to week 68 was -13.7% with semaglutide and -3.2% with placebo. P less than 0.001. The mean change in the WOMAC pain score at week 68 was -41.7 points with semaglutide and -27.5 points with placebo. P less than 0.001. Participants in the semaglutide group had a greater improvement in SF-36 physical function score than those in the placebo group, mean change, 12.0 points versus 6.5 points, P less than 0.001. The incidence of serious adverse events was similar in the two groups. Adverse events that led to permanent discontinuation of the trial regimen occurred in 6.7% of the participants in the semaglutide group, and in 3.0% in the placebo group, with gastrointestinal disorders being the most common reason for discontinuation. Conclusions. Among participants with obesity and knee osteoarthritis with moderate to severe pain, treatment with once-weekly injectable semaglutide resulted in significantly greater reductions in body weight and pain related to knee osteoarthritis than placebo. Inavolisib-based therapy in pica mutated advanced breast cancer. Background. Inavolisib is a highly potent and selective inhibitor of the alpha isoform of the P110 catalytic subunit of the phosphatidylinositol 3-kinase complex, encoded by pica, that also promotes the degradation of mutated P110 alpha. Inavolisib plus palbociclib fulvestrant has shown synergistic activity in preclinical models and promising antitumor activity in early phase trials methods. In a phase 3, double-blind, randomized trial, we compared first-line inavolisib at an oral dose of 9 mg once daily plus palbociclib fulvestrant, inavolisib group, with placebo plus palbociclib fulvestrant, placebo group, in patients with pica mutated, hormone receptor positive, human epidermal growth factor receptor 2, HER2 negative locally advanced or metastatic breast cancer, who had had relapse during or within 12 months after the completion of adjuvant endocrine therapy. The primary endpoint was progression-free survival as assessed by the investigator. Results. A total of 161 patients were assigned to the inavolisib group, and 164 to the placebo group. The median follow-up was 21.3 months and 21.5 months, respectively. The median progression-free survival was 15.0 months, 95% confidence interval, C, 11.3 to 20.5, in the inavolisib group, and 7.3 months, 95% C, 5.6 to 9.3 in the placebo group. Hazard ratio for disease progression or death, 0.43, 95% C, 0.32 to 0.59, p less than 0.001. An objective response occurred in 58.4% of the patients in the Inavolisib group and in 25.0% of those in the placebo group. The incidence of grade 3 or 4 neutropenia was 80.2% in the Inavolisib group and 78.4% in the placebo group. Grade 3 or 4 hyperglycemia, 5.6% and 0% respectively. Grade 3 or 4 stomatitis or mucosal inflammation, 5.6% and 0%. And grade 3 or 4 diarrhea, 3.7% and 0%. No grade 3 or 4 rash was observed. Discontinuation of any trial agent because of adverse events occurred in 6.8% of the patients in the Inavolisib group and in 0.6% of those in the placebo group. Conclusions. In patients with PICA-mutated, hormone receptor-positive, HER2-negative locally advanced or metastatic breast cancer, Inavolisib plus palbociclib fulvestrant led to significantly longer progression-free survival than placebo plus palbociclib fulvestrant, with a greater incidence of toxic effects. The percentage of patients who discontinued any trial agent because of adverse events was low. Isatuximab, Bortezomib, Lenalidomide, and Dexamethasone for multiple myeloma. Background. Bortezomib, Lenalidomide, and Dexamethasone, VRD, is a preferred first-line treatment option for patients with newly diagnosed multiple myeloma. Whether the addition of the anti-CD38 monoclonal antibody Isatuximab to the VRD regimen would reduce the risk of disease progression or death among patients ineligible to undergo transplantation is unclear. Methods. In an international, open-label, Phase 3 trial, we randomly assigned, in a 3:2 ratio, patients 18 to 80 years of age with newly diagnosed multiple myeloma who were ineligible to undergo transplantation to receive either Isatuximab plus VRD or VRD alone. Results. A total of 446 patients underwent randomization, at a median follow-up of 59.7 months. The estimated progression-free survival at 60 months was 63.2% in the Isatuximab VRD group, as compared with 45.2% in the VRD group. Hazard ratio for disease progression or death, 0.60, 98.5% confidence interval, 0.41 to 0.88, p less than 0.001. The percentage of patients with a complete response or better was significantly higher in the Isatuximab VRD group than in the VRD group, 74.7% versus 64.1%, p equals 0.01, as was the percentage of patients with MRD negative status and a complete response, 55.5% versus 40.9%, p equals 0.003. No new safety signals were observed with the Isatuximab VRD regimen. The incidence of serious adverse events during treatment and the incidence of adverse events leading to discontinuation were similar in the two groups. Conclusions. Isatuximab VRD was more effective than VRD as initial therapy in patients 18 to 80 years of age with newly diagnosed multiple myeloma who were ineligible to undergo transplantation. Total hip replacement or resistance training for severe hip osteoarthritis. Background. Total hip replacement is routinely recommended for severe hip osteoarthritis, but data from randomized trials are lacking regarding comparison of the effectiveness of this procedure with that of non-surgical treatment such as resistance training methods. We conducted a multi-center, randomized controlled trial to compare total hip replacement with resistance training in patients 50 years of age or older who had severe hip osteoarthritis and an indication for surgery. The primary outcome was the change in patient-reported hip pain and function from baseline to 6 months after the initiation of treatment, assessed with the use of the Oxford Hip Score. Results. A total of 109 patients, mean age, 67.6 years, were randomly assigned to total hip replacement, 53 patients, or resistance training, 56 patients. In an intention to treat analysis, the mean increase, indicating improvement, in the Oxford Hip Score, was 15.9 points in patients assigned to total hip replacement, and 4.5 points in patients assigned to resistance training. Difference, 11.4 points, 95% confidence interval, 8.9 to 14.0, p less than 0.001. At 6 months, 5 patients, 9%, who had been assigned to total hip replacement had not undergone surgery, and 12 patients, 21%, who had been assigned to resistance training, had undergone total hip replacement. The incidence of serious adverse events at 6 months was similar in the two groups. The majority of such events were known complications of total hip replacement conclusions. In patients 50 years of age or older who had severe hip osteoarthritis and an indication for surgery, total hip replacement resulted in a clinically important, superior reduction in hip pain and improved hip function, as reported by patients, at 6 months as compared with resistance training. Next, we will be discussing articles from Journal of American Medical Association. Differences in drug shortages in the U.S. and Canada. Question: how frequently are reports of drug-related supply chain issues associated with drug shortages in the U.S. versus Canada? Findings: in this cross-sectional study, there were 104 reports of drug-related supply chain issues that occurred from 2017 to 2021 in both countries. Within 12 months of the reported supply chain issues, 49.0% were associated with drug shortages in the U.S. compared with 34.0% in Canada, meaning drug shortages were less frequent in Canada compared with in the U.S. after drug-related supply chain issues were reported in both countries. These findings inform ongoing policy development and highlight the need for international cooperation between countries to curb the effects of drug shortages and improve the resiliency of the supply chain for drugs. Early intervention in patients with asymptomatic severe aortic stenosis and myocardial fibrosis. The evolved randomized clinical trial. Question: is early aortic valve intervention superior to guideline-directed conservative management in asymptomatic patients with severe aortic stenosis and myocardial fibrosis? Findings in this multicenter randomized clinical trial of 224 patients with asymptomatic severe aortic stenosis and myocardial fibrosis, there was no significant difference in the primary composite endpoint of all-cause death or unplanned aortic stenosis, stenosis-related hospitalization in patients randomized to receive early intervention versus patients randomized to receive guideline-directed conservative management, 18% versus 23%, meaning among patients with asymptomatic severe aortic stenosis and myocardial fibrosis, early aortic valve intervention did not improve clinical outcomes compared with guideline-directed conservative management. Next, we will be discussing articles from Annals of Internal Medicine. Projected impact and cost-effectiveness of novel molecular blood-based or stool-based screening tests for colorectal cancer. Background: cell-free DNA blood tests, cfDNA, and next-generation stool tests could change colorectal cancer (CRC) screening. Objective: to estimate the clinical and economic impacts of novel CRC screening tests. Conclusion: first-generation cfDNA tests may deliver net benefit or harm, depending on the balance between achieving screening in persons who decline alternatives versus substituting cfDNA for more effective alternatives. Comparative effectiveness and safety of Atorvastatin versus Rosuvastatin, a multi-database cohort study. Background: Rosuvastatin and Atorvastatin are the most widely prescribed moderate to high-intensity statins. However, evidence on their efficacy and safety during actual use is limited. Conclusion: this study found differences in risks for some important outcomes associated with Rosuvastatin and Atorvastatin. The differences were relatively small, and many did not meet traditional standards for statistical significance. Further research is needed to understand whether these findings can be used with confidence in clinical practice. Next, we will be discussing articles from British Medical Journal. Comparative effectiveness of sodium, Glucose cotransporter 2 inhibitors for recurrent nephrolithiasis among patients with pre-existing nephrolithiasis or gout, target trial emulation studies. Objective to emulate target trials comparing recurrence of nephrolithiasis among patients with pre-existing nephrolithiasis, overall and stratified by concomitant gout, initiating sodium glucose cotransporter 2, SGLT2, inhibitors versus an active comparator. Conclusions. The benefits associated with SGLT2 inhibitor for patients with nephrolithiasis in these target trial emulations suggest they may be a useful addition to current treatments to simultaneously manage nephrolithiasis recurrence and comorbidities, including gout. Next, we will be discussing articles from Lancet. The effect of tranexamic acid on postpartum bleeding in women with moderate and severe anemia. Woman 2, an international, randomized, double-blind, placebo-controlled trial. Background. Tranexamic acid, given within 3 hours of birth, reduces bleeding deaths in women with postpartum hemorrhage. We examined whether giving tranexamic acid shortly after birth can prevent postpartum hemorrhage in women with moderate or severe anemia. Interpretation. In women with moderate and severe anemia, giving tranexamic acid within 15 minutes of the umbilical cord being clamped did not reduce the risk of clinically diagnosed postpartum hemorrhage. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Clinical Oncology. Randomized Phase 2 Trial of Immunotherapy. Based total neoadjuvant therapy for proficient mismatch repair or microsatellite stable locally advanced rectal cancer, TORCH purpose. To assess whether the integration of PD-1 inhibitor with total neoadjuvant therapy (ITNT) can lead to an improvement in complete responses, CRs, and favors a watch and wait. WW, strategy in patients with proficient mismatch repair or microsatellite stable, pMMR/MSS, locally advanced rectal cancer, LARC. Conclusion. The ITNT regimens remarkably improved CR rates and pMMR/MSS LARC compared with historical benchmark with acceptable toxicity. Upfront SCRT followed by immunochemotherapy was selected for future definitive study. Here are the articles from Journal of Hepatology: Histological improvements following energy restriction and exercise. The role of insulin resistance in resolution of MASH. Diet and exercise improved liver histology in metabolic dysfunction-associated steatohepatitis. Standard of care improved metabolic health with minimal effects on histology. Peripheral, not hepatic, insulin sensitivity was related to histologic resolution. Improved substrate use at the muscle may relieve the liver of excess nutrients. Pfizer Seron for adults with alpha-1 antitrypsin deficiency liver disease, a phase 2 placebo-controlled trial, Sequoia background and aims. Homozygous ZZ alpha-1 antitrypsin, AAT, deficiency produces mutant AT, ZAT, proteins in hepatocytes, leading to progressive liver fibrosis. We evaluated the safety and efficacy of an investigational RNA interference therapeutic, Pfizer Seron, that degrades Z at messenger RNA, reducing deleterious protein synthesis. Conclusions. Pfizer Seron reduced serum and liver concentrations of Z at in a dose-dependent manner and reduced hepatic globule burden. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Evidence-informed provision of doxycycline post-exposure prophylaxis for prevention of bacterial sexually transmitted infections. Abstract. Doxycycline post-exposure prophylaxis, DoxyPEP, reduces the risk of bacterial sexually transmitted infections, STIs, among men who have sex with men and transgender women. In the United States, DoxyPEP is in an early stage of integration into clinical practice, and national guidelines for its use were recently released. The goal of this manuscript is to provide practical guidance for clinicians who are considering or currently prescribing DoxyPEP. We address 5 clinical questions. Using post-hoc analyses of data from the DoxyPEP, randomized controlled trial and discuss the potential implications and limitations of each question, with the goal of informing clinical practice and implementation of doxy-PEP programs. The questions address patient eligibility criteria for doxy-PEP, the expected benefit and associated doxy-PEP doses for the average patient, the initial number of doses prescribed, and laboratory monitoring of persons taking doxy-PEP. Next, we will be discussing articles in the field of rheumatology. Implementing Patient Health Questionnaire Depression Screening in Inflammatory Arthritis Clinic. Insights from a Quality Improvement Project at a Tertiary Rheumatology Center. Objective: this quality improvement project evaluates the feasibility and sustainability of adopting the Patient Health Questionnaire (PHQ) depression screening tool into routine clinical care at a rheumatology fellow's inflammatory arthritis (IA) clinic at a large tertiary center. The aim was to achieve 50% compliance in documentation of PHQ after 5 months. Conclusion: sustained adoption of the PHQ was difficult to achieve. Additional support at the health systems level that prioritizes depression screening may need to take place. Additional research demonstrating improved IA outcomes in screened patients may also be helpful to gain more buy-in from providers. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. RNA helicase DDX5 maintains cardiac function by regulating CAMCA2 delta alternative splicing. Background: heart failure, HF, is a leading cause of morbidity and mortality worldwide. RNA-binding proteins are identified as regulators of cardiac disease. DDX5, dead box helicase 5, is a master regulator of many RNA processes, although its function in heart physiology remains unclear on conclusions. These findings reveal a role for DDX5 in maintaining calcium homeostasis and cardiac function by regulating alternative splicing in cardiomyocytes, identifying the DDX5 as a potential target for therapeutic intervention in HF. Here are the articles from Journals of the American College of Cardiology. Urinary metal levels and coronary artery calcification. Longitudinal evidence in the multi-ethnic study of atherosclerosis. Background: exposure to metals, a newly recognized risk factor for cardiovascular disease, CVD, could be related to atherosclerosis progression. Objectives: the authors hypothesized that higher urinary levels of non-essential cadmium, tungsten, uranium, and essential cobalt, copper, zinc, metals previously associated with CVD would be associated with baseline and rate of change of coronary artery calcium, CAC, progression, a subclinical marker of CVD in MESA, multi-ethnic study of atherosclerosis. Conclusions: exposure to metals was generally associated with extent of coronary calcification at baseline and follow-up. These findings support that metals are associated with the progression of atherosclerosis, potentially providing a novel strategy for the prevention and treatment of atherosclerosis progression. From JAMA Cardiology. Leadless ultrasound-based cardiac resynchronization system in heart failure. Question: is leadless left ventricular LV endocardial pacing using ultrasound energy safe and effective for providing cardiac resynchronization therapy, CRT, to patients whose conventional CRT using a coronary sinus lead failed? Findings: in this prospective clinical trial, N equals 183, 80.9% of patients were free from device and procedure-related adverse events. The average improvement in mean LV and systolic volume was -16.4%, meaning in this study, for patients with failed coronary sinus lead placement for CRT, a leadless LV pacing system using ultrasound energy holds promise as a viable alternative. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Increased prevalence of germline pathogenic CHEK2 variants in individuals with pituitary adenomas. Context: CHEK2 is a cell cycle checkpoint regulator gene with a long-established role as a clinically relevant, moderate-risk breast cancer predisposition gene, with greater risk ascribed to truncating variants than missense variants. Objective: to assess the rate and pathogenicity of CHEK2 variants amongst individuals with pituitary adenomas, PA's conclusion. This is the first study to suggest a role for the breast cancer predisposition gene, CHEK2, in pituitary tumorigenesis, with pathogenic/likely pathogenic variants found in 3% of patients with PAs. As PAs are relatively common and typically lack classic autosomal dominant family histories, risk alleles, such as these variants found in CHEK2, might be a significant contributor to PA risk in the general population. Here are the articles from Diabetes Care. Sitting time and its interaction with physical activity in relation to all-cause and heart disease mortality in U.S. adults with diabetes. Objective: to evaluate whether associations between sitting time and all-cause and heart disease mortality are modified by physical activity in adults with diabetes. ASI inclusions. In adults with diabetes, meeting guideline recommended physical activity may offset the elevated all-cause and heart disease mortality risk associated with excessive sitting time. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. The effects of positive end expiratory pressure on pulmonary vascular resistance depends on lung recruitability in patients with acute respiratory distress syndrome. Rationale: a U-shaped relationship should exist between lung volume and pulmonary vascular resistance, PVR, with minimal PVR at FRC. Thus, positive end expiratory pressure, PEEP, in patients with acute respiratory distress syndrome, ARDS, should increase PVR if it induces significant lung distension compared with recruitment. However, this has never been proved in patients. Objectives: to study the effects of PEEP on PVR according to lung recruitability, evaluated by the recruitment to inflation RI ratio. Conclusions: PEEP increases PVR only when it induces significant lung distension compared with recruitment according to the RI ratio. Tailoring PEEP on this recruitability index should mitigate its hemodynamic effects. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. https://journals.lww.com/ciajuzen/pages/parenttalk.aspase. Here are the articles from Kidney International Reports. Prospective trial on the pharmacokinetics of clopidogrel in hemodialysis patients. Introduction. Hemodialysis patients, HDPs, exhibit extensive cardiovascular risk. The widely prescribed antiplatelet agent clopidogrel is metabolically activated by cytochrome enzymes, which may be impaired by uremia and chronic low-grade inflammation, typically present in HDPs. We conducted a prospective multicenter study to investigate the pharmacokinetics and pharmacodynamics of clopidogrel in HDPs and healthy volunteers. HVs. Results: 17 HDPs and 16 HVs were included. The maximum concentration of clopidogrel's active metabolite was significantly lower in HDPs compared to HVs. Median interquartile range, 12.2, 4.6 to 23.4, versus 24.7, 17.8 to 36.5, Ing/ml, p equals 0.02. The maximum concentration ratio of clopidogrel's active metabolite to prodrug was 8.5-fold lower in HDPs, and an 82.7% reduced clopidogrel clearance, including clopidogrel's active metabolite formation, was found using population pharmacokinetic modeling. From previous studies, adenosine diphosphate-induced platelet aggregation at 120 minutes was significantly higher in HDPs than in HVs. Median interquartile range, 26U, 14U, 43U, versus 12U, 11U, 18U, p equals 0.004. Pantoprazole terminal half-life was 1.7-fold higher in HDPs compared to HVs. Conclusion. Our data demonstrate an altered metabolism of clopidogrel in HDPs in the context of lower CYP2C19 activity, with potential implications for other substances metabolized by this enzyme. A survey on end-of-life contemplation among patients on dialysis. Introduction. Considering that mortality among patients on dialysis is high, it would be advisable for patients, relatives, and caregivers to acknowledge that after dialysis initiation for many patients, the last phase in life has begun. We sought to investigate the frequency of precautionary planning directives, contemplation about the end of life, EOL, and embedding of patients' wishes in the interaction with relatives and the treating nephrologist's results. From 349 identified patients, 268, 77%, participated. The participants, 36% female, had a median age of 70, interquartile range, IQR, 58 to 80, years and had spent a median of 3, IQR, 1 to 7.5, years on dialysis. Overall, 46% of patients on dialysis contemplated their EOL wishes at least occasionally. Of those, 85% talked about EOL wishes with their relatives, whereas 19% discussed them with their nephrologists, yet another 28% would like to have such a discussion with their nephrologist. Conclusion. Almost half of patients on dialysis contemplate their EOL, and the vast majority engage in discussions about that with their relatives. Despite patients being interested, the frequency of consultation of nephrologists on EOL care is low. This study suggests that there is a substantial but unmet need for EOL care consultation for patients on dialysis.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.